When people hear the word cancer, they don't necessarily think first about the pain, but ask anybody who's been through a diagnosis and treatment, and they'll tell you that pain is very much part of the experience. Mesothelioma can cause significant pain from the tumor itself, from treatments, and from complications. But here's what you need to know. Modern pain management is highly effective, so you don't have to suffer through unbearable pain. Today, I want to explain the different types of pain that mesothelioma causes, the full range of pain management options from medications to procedures to complementary approaches, and finally, how to work with your medical team to achieve good pain control. I'm Terri Oppenheimer, and I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But understanding pain management options helps you advocate for adequate pain relief. So let's start with understanding the types of pain mesothelioma causes. When we're talking about pleural mesothelioma, you're dealing with chest wall pain that comes from the tumors having invaded the chest wall, ribs, or muscles. This is often described as a constant, dull ache with sharp pain when breathing deeply or coughing. Pleural pain from a tumor irritating the pleura or inflammation can cause sharp, stabbing pain that worsens with breathing. By contrast, when we're talking about peritoneal mesothelioma pain, patients are experiencing abdominal pain that can be cramping, aching, or sharp pain. Again, it's from tumors pressing on the organs or obstructing the bowel. In both cases, bone pain can develop as mesothelioma spreads, and that causes deep aches that get worse at night. Nerve pain or neuropathy can occur if tumors are putting pressure on the nerves, and it can cause electric shock sensations or burnings. Post-operative pain after surgery is acute, but it can usually be controlled with medications and improves over weeks. Treatment-related pain from chemotherapy side effects include neuropathy or inflammation, can come from radiation. Pain management approaches depends on the type and severity of your pain. The World Health Organization Pain Ladder provides a framework for this. For mild pain, you use non-opioid medications like acetaminophen or non-steroidal anti-inflammatories like ibuprofen or naproxen if they're considered safe for you by your doctor. These medicines are appropriate for mild discomfort, but they're insufficient for moderate to severe cancer pain. Now, before I go up the pain scale, I'm going to take a break here to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe button. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, getting back to the different levels of pain management, for moderate pain, doctors use weak opioids like tramadol or codeine, and that's often combined with acetaminophen. These do provide stronger pain relief than non-opioids alone. And for severe pain, they use strong opioids like morphine, oxycodone, hydromorphone, or fentanyl. These are the mainstays of cancer pain management, and you shouldn't let fear of these drugs prevent you from getting adequate pain relief. When used appropriately for cancer pain, opioids are safe and effective. While concerns about addiction to opioids in the general public are valid, they're misplaced in cancer pain management. Physical dependence is different from addiction, and taking medication as prescribed for legitimate pain does not constitute addiction. Long-acting opioids provide baseline pain control with medications that last 8 to 12 hours or longer. These are taken on a schedule rather than as needed, while short-acting or immediate release opioids can also be taken for breakthrough pain. That's sudden flares of pain that break through baseline medication. You can take these as needed in addition to your long-acting medication. Good pain control usually requires both, long-acting for the baseline and short-acting for breakthrough. And there's nothing to feel guilty about if that's what you need. Adjuvant medications aren't pain medications themselves, but they help manage specific pain types. For nerve pain, adjuvant medications like gabapentin or pregabalin reduce nerve-related pain that doesn't respond well to opioids alone. For bone pain, medications like steroids or biphosphonates can help. For pain with muscle spasm, muscle relaxants like, I can't even pronounce it, they might help. And anti-anxiety medications can help with pain perception. These are used in combination with opioids for better overall pain control. Interventional procedures for pain include nerve blocks where anesthetic or steroids are injected near the nerves to block pain signals. This can provide weeks or months of relief for specific pain areas. Epidural drug delivery can be done through an injection directly to the spinal cord, and this provides excellent pain relief with lower medication doses and fewer side effects than oral medications. Radiation therapy can shrink tumors causing pain, and palliative radiation to painful areas can provide real relief within days to weeks. For pleural effusions causing chest pressure and pain, thoracentesis or a pleural catheter placement to drain fluid often provides immediate relief. For ascites causing abdominal pain and pressure, paracentesis or a peritoneal catheter placement helps. Non-medication approaches that complement medical pain management include heat or cold therapy, that's heating pads or ice packs, and they can provide relief. Gentle massage can reduce muscle tension and pain. Physical therapy can maintain mobility and reduce pain from stiffness or muscle weakness. And relaxation techniques like deep breathing or progressive muscle relaxation reduce pain by decreasing muscle tension and anxiety. You can get involved in activities that distract you. Even conversation can reduce pain perception. Then there are mind-body approaches like meditation, guided imagery, and hypnosis that have been shown to help manage pain. I'll discuss those more in other videos. There's evidence that acupuncture can help some types of cancer pain. Here's what you need to know about how to work with your medical team for good pain control. Be honest about your pain level. Use a 0 to 10 scale where 0 is no pain and 10 is the worst pain imaginable. Report your pain levels consistently so your team can track whether your treatments are working. Describe your pain specifically. Where it is, what does it feel like? Is it sharp, dull, burning, or aching? And when does it occur? And what makes it better or worse? How does it affect your function? Take your pain medications as prescribed on schedule, not just when pain becomes severe. Staying ahead of pain is much easier than trying to catch up once your pain is out of control. Report side effects you're experiencing, whether it's constipation, nausea, drowsiness, confusion. Many side effects can be managed without stopping effective pain medication. Don't hesitate to ask for stronger or different pain medication if your current treatment isn't controlling your pain adequately. Your oncologist or a pain specialist can adjust your regimen. Consider asking for a referral to a pain management specialist or palliative care team if your pain is difficult to control. These are specialists who focus specifically on symptom management, and they can often achieve better pain control than general oncologists do. There are some common barriers to good pain control that you should avoid. The most common and most self-defeating is believing you should tough it out or that pain is inevitable. Modern pain management can control most cancer pain effectively. You don't have to suffer. Other problems and barriers, fearing addiction to pain medication. This fear prevents many patients from taking adequate medication. Addiction is extremely rare when opioids are used appropriately for cancer pain. Waiting until pain is severe before taking medication is a big problem. Pain is much easier to prevent than to treat once it's severe. Take your medication on schedule and it will prevent your pain rather than making you chase it. Not reporting your pain to your medical team because you don't want to complain is a problem. Pain is a medical symptom that requires treatment. It's not a weakness and it's not an annoyance. You shouldn't believe that pain means your cancer is getting worse and you'd rather not know about it. Pain doesn't always correlate with disease progression, and knowing about pain means your doctors can treat it. So let them know. What if you're on the maximum dose of pain medication and you're still having breakthrough pain? This requires some creative problem solving with pain specialists. Options include switching to different opioid medications because that kind of rotation can sometimes improve pain control. Or you can add more adjuvant medications or interventional procedures like nerve blocks or spinal drug delivery. You can have radiation administered to painful areas or address any contributing factors like anxiety or depression that amplify your pain perception. To review, mesothelioma pain can be effectively managed with modern pain management approaches, including opioid medications, weak opioids for moderate pain, strong opioids like morphine or oxycodone for severe pain, adjuvant medications for specific pain types, interventional procedures like nerve blocks, radiation therapy to shrink painful tumors, and complementary approaches like heat, massage, and relaxation techniques. Take your medications on schedule as prescribed. Report your pain honestly to your medical team, and don't fear appropriate opioid use. Finally, ask for a specialist pain referral, a referral to a specialist for pain management if nothing else is working. You can visit mesothelioma.net for more information on pain management and other things that will help you with your mesothelioma diagnosis. Or you can call 1-800-692-8608 to speak to one of our helpful patient advocates right away. As for me, remember to put your questions in the comment section below, and I'll see you next time.